Hello, my name is Chandlin Harrell, and today I will be going over a large disease called interstitial lung disease. I know you all are wondering why this disease is so important to care about. Well, I'm about to tell you why. Interstitial lung disease is a large disease that anyone can get, including children. Many things can increase the risk of or cause interstitial lung disease, including genetics, certain medications, or medical treatments such as radiation or chemotherapy. People with autoimmune diseases such as sarcoidosis or rheumatoid arthritis are also an increased risk of developing ILD. People who smoke can not only cause ILD, but can make the condition much more worse. The history of interstitial lung disease. Interstitial lung disease is an umbrella term for a large group of disorders that cause scarring fibrosis of the lungs. The scarring causes stiffness in the lungs, which makes it difficult to breathe. ILD can be caused by exposure to hazardous chemicals, certain medications, and medical treatments. Most cases, the causes are unknown. ILD is irreversible and progressive, which means it gets worse over time. Most people with ILD is recommended for lung transplants. More than 180 disease entities are characterized by acute, subacute, and chronic inflammatory infiltrations of alveolar walls by cells, fluid, and connective tissues. If ILD is left untreated, the inflammatory process can progress to irreversible pulmonary fibrosis. Etiology/pathology. There are more than 180 different pulmonary disorders classified as ILD. The major pathologic changes associated with chronic ILDs are destruction of the alveoli and adjacent pulmonary capillaries, fibrotic thickening of the respiratory bronchioles, alveolar ducts, and alveoli, granulomas, honeycombing and cavity formation, fibrocalcific pleural plaques, bronchospasms, and excessive bronchial secretions. The general description. A general description of ILD is a produced restrictive lung condition which bronchial inflammation and excessive airway secretions can develop in the small airways. The clinical manifestations associated with an obstructive lung disorder. Therefore, patients with ILD may demonstrate a restrictive disorder, an obstructive disorder, or a combination of both. Abnormal bedside clinical findings. Increased respiratory rate, increased heart rate and blood pressure, cyanosis, digital clubbing, peripheral edema and venous distension, non-productive cough. Chest findings would be increased tactile and vocal fremitus, dual percussion note, bronchial breath sounds, crackles, and pleural friction rub. Studies conducted. The current study of ILD is to investigate the efficacy and safety over 52 weeks in patients with progressive fibrosing interstitial lung disease, defined as